today let me give you a few insights in the oral habit of Bruxism. What is Bruxism? It is the clenching or grinding of teeth, especially during the night time. The parents or caretakers, they get very much worried when they see their children grinding their teeth, especially during the night. So what are the reasons for this habit of Bruxism? It can be anatomical, pathological or psychological. The anatomical reasons, it is due to improper alignment of teeth. Okay? If it is due to pathological, then it is due to the pain caused by ear infection or dental infections or due to newly erupting teeth. And psychological reasons could be due to a sudden shift, like change in environment to residential schools or change of place, or any problem with academic subjects or particular teachers or among the peer groups and so on. So these are some of the reasons for Bruxism. So what are the effects of this habit? It causes abrasion, that is wearing away of the tooth structure, which leads to very sensitive teeth and jaw pain. Sometimes the TMJ problem, that is the joint pain, but it is not very commonly seen in children. So what is the line of management? So we definitely need the professional guidance for this, and pediatric dentists come a long way to help you out. So they first diagnose the cause for the habit, whether it is anatomical, pathological or psychological. If it is going to be anatomical, then they will suggest you treatment modes for proper alignment of teeth. If it is going to be pathological, that is due to ear infection or dental infection or the newly erupting teeth, then the treatment for the infection will be the first line of management. And if it is going to be due to psychological reasons, sometimes we may need expert guidance from clinical psychologists, so referrals may be done. And night guards are provided by taking impressions, and customized night guards are prepared, similar to something like the mouth guards worn by the sports personalities, so that they prevent the more deleterious effects on the dental structures. And sometimes even restorations of the teeth, as the superficial layer has been abraded, can be suggested. So when you find your child suffering with this habit of Bruxism, do seek the professional guidance of pediatric dentists. Thank you.